Morning, John. I'm doing great. It's a beautiful morning.
It is, isn't it? I wonder if we should get this underway. I don't know. Nobody said go. So you and I can take it upon ourselves to do that, I think.
Okay, I'm ready to roll, John.
Yes. What time does the 10 a.m. meeting begin? I like that idea. So let's start with a welcome and a couple of, for lack of a better phrase, a couple of housekeeping things. My name is John Hines, and I am recently retired, mostly retired after a very long radio career. And we are putting together this very special webinar to answer some questions, address some concerns, especially as they came up in a recent survey conducted by Blue Cross Blue Shield of Minnesota. So, and Dr. Mark Steffen is here. He is the Chief Medical Officer for Blue Cross. And we're so glad that he is with us today. He oversees the medical management programs and the strategies for nearly 3 million members. So just to give you that idea. And the beauty of it is, and I just recently learned this, he's a native of Minnesota, from Zumbrota, as a matter of fact, in the southeastern portion of the state. And I think some background in apples. I'm going to get to that question, Dr. Steffen, if that whole idea of an apple a day is just a myth or if there's some validity to that, especially as we are taking better care of ourselves. But first of all, welcome. I appreciate your being on with us on this fabulous webinar opportunity.
Yeah, thanks, John. And you know, as you said, I grew up on an apple orchard in a really small town in southeastern Minnesota. So I'm a big believer in the apple a day keeps the doctor away. And in fact, it turned me into one. So I'm not quite sure how that works. But I've spanned, most of the state in my career. I did some training up in our beautiful North Country in Duluth, finished some of my medical school career in the Twin Cities, and then have been lucky enough to have practiced both in rural Minnesota, back in my hometown, and then spent about 5 years, and the last 5 years of my clinical career before coming to Blue Cross at Mayo Clinic down in Rochester, Minnesota. So, committed to Minnesota, love being here, and this is one of the most beautiful times of the year as I get to watch some of the trees change into those beautiful oranges and reds.
All right. Hey, let's talk about this too. A couple of other housekeeping notes here. For the duration of this meeting, we're going to be disabling the chat function, but you still will have the opportunity to participate. We encourage participation and having you send questions throughout the event in the Q&A function at the bottom of the Zoom window. And when we get past some of the very vital information, we will address as many of those questions and opportunities as the time allows. So we wanted to get into that. Let's talk a little bit, Dr. Steffen, about where we are today. I think from the end of August to the middle of September, Blue Cross conducted this survey of some 500 participants, asking them questions to get their idea on their current, health concerns, especially as we deal with this pandemic. Tell me a little bit about what you know about that survey.
Yeah, John, it was great. We wanted to understand how people are experiencing the pandemic. I think it's been a challenging time for everyone. And certainly we want to make sure that we're supporting our members, our community, and our state the best way that we can. One of the big themes that I saw come out of the survey is resilience. And we found that Minnesota seniors are resilient. It's not surprising to me, right? I think of Minnesotans kind of like I think of Marines. They improvise, they adapt, and they overcome. And I think we're used to that. And, frankly, we're headed into one of our beautiful winters where we have to do that on a yearly basis. But I think it's an important factor in getting through this pandemic together is that we all really develop and encourage that sense of resilience and community that I think will help us succeed.
I think you're absolutely right. The beauty of that is, though, when you talk about the resilience, or I shouldn't say the beauty. The important thing is we don't want to minimize the importance of some of these health concerns that so many seniors may have. And that's where they'll surface when we get to those questions a little later on. But there are some genuine concerns, and there should be, as well as some genuine steps that we can all take to not ensure, but to give us the best opportunity for better health, Dr. Steffen.
Yeah. And what was great, John, was that, as we looked at how people responded, nearly 9 out of 10 people were inspired to do something good for their health. Despite the pandemic, they were really developing new health goals. And I think that is going to be supportive. One of my biggest concerns as we go through this pandemic is the social isolation that people can experience. We've had a lot of guidance from our state and public health officials, and great guidance that we need to ensure that we're physically distancing. Right, COVID is transmitted when we're close to people who have the disease, and they've encouraged us to physically distance. But I think it's important for us to differentiate physical distancing from social distancing. We can still remain physically distant from people while staying socially connected. We have all of this wonderful technology. You're all joining us on a Zoom webinar, and we're able to create this social connection with one another despite being extremely physically distant. And I'm hopeful that we have visitors from all over the state joining this webinar. So I think that we can think through, how do we use this technology? How do we use all of the things at our disposal to maintain those connections to the people that are most important to us?
Let me, for folks who maybe just joined along the way, let me recap a little bit about who we are and what we are doing. I'm John Hines, retired radio guy and lifelong Minnesotan. And also joining me, Dr. Mark Steffen, who is the Chief Medical Officer for Blue Cross, who advises in so many areas, but particularly as it relates to our conversation today about better health for seniors. Is it sort of an obvious factor here, or a consideration, Dr. Steffen, that so much of this is coming down along with the pandemic that people are discussing all the time? It leads all the newscasts. It's the front page of the paper, and it's been above the fold since March. Is it becoming even more critical, more crucial as we come into this time of year in Minnesota, where we find ourselves in the fall here, perhaps more closed in, and maybe even greater distance from our family and some of our close friends?
Yeah, I think, John, you're touching on an important topic. And part of the survey really identified some of the social isolation that seniors are experiencing already. 1 in 5, in fact, reported feeling lonely, anxious, or even depressed. And I do think that social isolation can play a big component in this. I think we're all used to, as Minnesotans, being a little more socially isolated in the winter times because, frankly, it's hard to get out through some of those deep snows that we get, or the deep colds. But like I said, John, I think that in this day and age, we're more capable than ever of being able to connect despite some of those physical factors. And I think that that's probably why we saw the resilience that we saw within the survey. And despite the pandemic, and despite restricting some of our activities and what we would normally do, we saw that people really kept a positive attitude throughout this, and really developed that resilience that I think is going to pay dividends to their health long term.
I don't know of too many medical professionals, I'm sure you can find them at various places, who don't put an emphasis at this time of year especially, and maybe even a greater emphasis now on something as simple, something as basic as a flu shot, Dr. Steffen.
Yeah, John, it's really important. If you look back through history and you look at some of the greatest medical developments that have ever occurred, immunizations is at the top of that list every single time. We need to remember that, despite there being a COVID pandemic, we're going into a time of the year where we always have influenza that's circulating. And the great thing about influenza is that we have a good protective mechanism, and that's the flu shots. It's really CDC recommendations say that anyone over the age of 6 months and who doesn't have other contraindications to getting a flu shot should go out and get one. And this is the optimal time of the year to get yours scheduled and make sure that you get it done before we have flu that's circulating within the community.
And these things become, as you mentioned, a greater concern as we find ourselves more closed in at this time of year and with more folks. I think it was very recently, Dr. Steffen, that there was a list of a number of important guidelines as we head into some of the holiday seasons here with Thanksgiving looming on the horizon. Just such a great time to bring family and friends together, but with some notes of caution in a situation like that.
Yeah, I think that's exactly right, John. The guidance that's out there is still emphasizing the importance of two things, really. Using a mask when you're going to be out and around people where you aren't able to, or you're unsure if you're going to be able to maintain physical distance from those individuals. And then just physically distancing in general. And I know it's a challenge. I know it gets tiring, but it is so important. And we're seeing places where some of those restrictions get relaxed, that we see increasing amounts of COVID being spread. And it's a really hard disease because the difficult piece of COVID is that there's people who don't get symptoms but are still able to spread the disease. And so, we need to be careful all the time and understand that those guidance, particularly the physical distancing guidance and particularly the mask wearing, is going to be something that's not only going to protect us, but it's also going to protect our family, our friends, and our communities at large.
When we talk about staying up on all immunizations, and the focus is on influenza vaccine at this time of year, the neat opportunity about being a part of the Blue Cross family is the fact that there are those annual wellness visits that are a part of the coverage. What should people be looking for? What should they expect when they participate in that wellness visit?
Yeah, I think what's unique about the annual wellness visits is it's really set up for you to create a prevention plan with your doctor. And I think that this is so important. I spent a lot of my years of my training doing preventive medicine and understanding preventive medicine, but to take a focused period of time where you can sit down with your physician and be able to lay out a plan that allows you to keep well throughout the year is so important. Big piece of that keeping well, John, is those immunizations. And an interesting study out of the Mayo Clinic recently was showing that immunizations, even other than COVID immunizations, can help protect against COVID. The exact mechanism isn't well understood, but if you ever needed another reason to ensure that you're getting the flu shot, or that you're getting all of your immunizations, frankly, it could potentially help protect you from COVID throughout the year.
Yeah, see, you're raising something here, Dr. Steffen, that brings to mind so many questions that I have, but This isn't about me. I would very much like to, maybe after we complete this webinar gathering here for Blue Cross, we can do that. Let me remind folks too that there is an opportunity for you to participate by using the Q&A function. We have disabled the chat right now because of the importance of having this opportunity for you, Dr. Steffen, to chat, but maybe there'll be an opportunity when we get to the end to answer as many questions as possible. So there's a Q&A function at the bottom of the Zoom window, and you can look into that at that time. So we touched on this just briefly about holiday gatherings. Give me some of those guidelines. We hear them from time and time again from the CDC and such about trying to do the best we can with each other when we come into these holiday gathering situations.
Yeah, and John, I think it's important to realize, there aren't any no risk scenarios. When you aren't around people outside of your family, there's opportunity and there's chance to get exposed. And I think what's important is to do the things that can minimize your risk of really contracting COVID. And those things are the same things that we do to protect ourselves from the flu. So things like good hand hygiene, making sure that we're washing our hands frequently, using hand sanitizer if we don't have access to a regular hand washing. I think some of the added precautions that we've seen with COVID is the mask wearing. And this is an important step. And I think as public health officials have looked at those results, the evidence is clear. We can minimize the transmission of COVID by wearing masks. And then the last piece is the physical distance piece. And this does get difficult in the holiday times. This is a time when we're used to gathering with family or friends. But we need to realize that as those gatherings get larger and larger, the risk of being exposed and then potentially contracting COVID gets higher and higher. And as we've looked at who's most impacted or who has, quote unquote, the worst cases of COVID, we see that individuals over the age of 60 tend to be the ones that are most impacted by COVID. So I think it's the same group of individuals that we want to make sure are taking all of those extra precautions.
When you looked at the survey results, and you touched on this one earlier, that some 9 in 10 seniors feel inspired to pursue at least one health goal. Was that a surprise? Or does that go back to, as you've been highlighting, the resiliency?
Yeah, it was a surprise, John. I think that, and I don't know what the result is or why that result was there. Maybe people have had a little bit more time to think about their health and reflect on their health and say, what do I want to do for myself to become healthier? I think what I've seen in just through friends and family members is I've seen a lot of people engaging more with the outdoors. Particularly given that we were in the summer months that are, it's awful beautiful, and now we're in these fall months where there's nothing more fantastic than taking a stroll down the street and looking at the beautiful colors in the trees. And we know that this engaging with the outdoors can be protective both for our physical and mental health. And there's great studies out there that people that engage with green spaces in general will have better mental health outcomes. And most of them are engaging with nature through walking, and boy, it never hurts to get a little exercise.
One of the things about that survey that I thought was great and a surprise, because I'm probably not in this category, is the fact that a majority of those 9 in 10 plan to get started right away. And this coming from a world-class procrastinator here, it's like, yes, I'll get, but they are. I mean, they're taking steps, and maybe this goes to the fact that we need to take more personal responsibility for our personal health, Dr. Steffen.
Yeah, I think it's personal responsibility. And also, John, I think it's taking that time to reflect and having that time to engage. I think that people had to take some things off their plate, not by choice. Maybe they were going out and interacting with friends or family more often, and they had a little bit more time to say, hey, what do I need to do for me to ensure that I stay and get healthy? And that may be a good result of all of this, that people are really pursuing those health goals that maybe they've had for a long time and are just now getting the opportunity to really focus in and engage with.
Something you mentioned early on was the technology that we have available to us today to try to maintain a greater social interaction, yet maintain the distance. How about some ideas, Dr. Steffen, about some ways in which we might utilize this technology for a greater physical opportunity, whether it's watching a workout video. These things have had a resurgence here of late as people find themselves, trying to take better care.
Yeah, it's so important, John. I think that technology is really enabling us in a lot of ways, and we're seeing big companies roll out a lot of virtual health options for people, whether it be, Apple announcing that they're going to get into some of this streaming of virtual physical fitness classes. We've seen companies like Peloton that do home virtual spin classes do very well during the pandemic. So I think the options are aplenty. What I think is really important is that people find that thing that's the right fit for them. So for my mom, it's yoga. She has always and has loved to engage in yoga. Had used to do that in a class at a community center in Rochester, but now has had to do that at home and found a lot of great joy out of being able to engage in some of those virtual options to do that at home. So I think that the good thing about all of this technology is that it has enabled us to engage and find things that are the right fit for us that can really improve our health over the long term.
I think interesting to note too, in this survey that was done by Blue Cross, we mentioned this earlier, some 500 Minnesotans participated, most recently from the end of August to mid-September when they took this survey period. So we had a chance to sort of see some of the effects of the time all gathered in here. But I think one of the things about this that I found interesting was the fact, we've talked about this numerous times, the resiliency and such, but wanting to stay all of the basics that we've been told over and over again. And there is a hopefulness, there is a pretty good interest in the fact that we're going to come out the other side. I hate the term new normal, but things will change, Dr. Steffen.
Yeah, I think that the advances that they're making with the science are going to pay dividends. We always read and see a lot of news about upcoming potential immunizations for COVID. I think we're all looking forward to the science developing quickly. The important piece of that is science is going to help protect us. When they get an immunization, it's going to help protect us. But there's things that we can do now that are going to protect us as well. And so I think, focusing on those things that we have the opportunity to impact now are great. And I do think that we'll see, scientific advances that are going to help protect us into the future.
Yeah, you're also going to find, for those of you who are a part of this webinar gathering here, again, I'll reset. Dr. Mark Steffen is the Chief Medical Officer for Blue Cross. My name is John Hines, and I'm just here to, I'm sure not here to answer the questions because I don't necessarily have those answers as we've seen. But there will also be a poll and such. Can I just throw out a couple of these Q&As here? Is this an okay time for me to do that, Dr. Steffen? Let's do that.
Yeah, John, let's
get them. Wearing masks for COVID, does that also affect the flu? I know you kind of touched on that. Will we maybe have less flu cases because of those masks and distancing?
Yeah. So it's a great question, John, and I think we've seen some evidence of this. It's always hard to tell with the flu because if you look back through time, we have kind of waxing and waning amounts of flu from year to year. It depends on what type of flu strain is out there, how good the flu immunization was at protecting us. But in general, the same things that you do to protect yourself from COVID are going to be the same things that are going to protect you from the flu, which could be a great outcome of all of this. And, I hope that we see lower levels of the flu, but I still think it's important for us to remember that getting the flu vaccine is still going to be something that's going to protect us. And COVID and the flu are spread in similar manners, mostly through respiratory droplets. So, the hand hygiene that we typically do during flu season, all of those things should continue to apply. And I think, and I hope that we see lower levels of flu this season.
Okay, a couple of other questions here. And I mentioned this earlier about the annual wellness visit that is a part of those who participate with Blue Cross. Is that different from their annual physical? And if so, what should they be asking for? And maybe we can get an answer here. I think Sarah Mulder, who is standing by, might be able to help with this. Is that true, Sarah? Or did I misread that?
Let me take a shot at it, John. Yeah. So, I think it is annual wellness visit and your annual physical. What I encourage seniors to do is get in contact with their doctor and tell them that they're interested in getting their annual wellness visit. A lot of our clinics and a lot of the providers in the state have set up great processes for these. And, I think it's the wonderful thing about being in Minnesota. We're blessed with high quality care providers across the state. And so I encourage people, get in touch with their doctor. They can walk you through these processes and what's included. And a lot of them have taken steps to ensure that you can stay safe while engaging with the healthcare system. But I think that first step is really getting in touch with your primary care provider, and they'll help you walk through all of the processes.
I'm looking at some responses to a poll, and we'll ask other people to participate as well. But the overall question, the overarching question was, assuming it was safe to do so, what activities are you most looking forward to resuming after the pandemic is over and all restrictions would be lifted? And the primary one, and I think this just speaks to who we are as a people, visiting friends or family. I was surprised to see, I thought that dining out would be higher up on the list. But another one that is on this list too that has a pretty good response, Dr. Steffen, is traveling or vacationing. I don't know about others, but I have had to put some such plans on hold. And it's one of those things I'm most looking forward to when we get to a normal, when restrictions have been lifted.
Yeah, John. And I mean, let's face it, we're coming up on a time in Minnesota where it turns awful cold. and there's an awful lot of people who flee the state for warmer areas of the country. And so I'm not surprised by seeing people really wanting to be able to re-engage with the travel and vacation. And, the top one, the visiting family, friends and family, I think everybody misses that, right? I think that we all enjoy and are energized by engaging with the people that we love the most. And frankly, for me personally, that's been the most difficult part of this pandemic. And so I would agree with everyone. Those are the top two on my list for sure. But, I said it before, John, I really want people to pay attention. I don't want us to lose momentum as a state in our focus on helping to prevent more COVID transmission throughout the state.
I am curious, because I hear this from time to time among friends and associates about the idea of wearing a mask, which is one of the primary things from the CDC, from many of our own physicians about keeping the best health opportunity, others saying that they don't really do anything. Can you explain to those who are participating, to those who are listening to this webinar, Dr. Steffen, exactly why such a practice is important?
Yeah, and so it goes down to how COVID is spread, and it's really spread through respiratory droplets. So every time that we even speak, but particularly if we're coughing or sneezing, we expel these tiny respiratory droplets. You can't see them, but they're spread. What a mask does is it prevents those respiratory droplets from going out into the air and onto other objects. Rather, it stays on the mask. So that's really the primary method of protection from those masks.
Here's a question that comes in saying, we're snowbirds. How can we use those people you talked about who like to get away? How can we use Blue Cross Blue Shield as a resource for healthcare concerns that we may have when we are out of state? Do you have any insight into that, Dr. Steffen?
Yeah, I mean, you certainly can continue to engage with our broad network of healthcare providers as you travel. I encourage people, if they have questions specifically about where they're traveling, they can call the number on the back of our card and get in touch with our customer service to ensure that they can meet their healthcare needs wherever they're traveling to.
Here's one I can make maybe a little more broad than this. A friend of ours, Michael, says, our son is getting married outside November 13th. My wife and I are struggling with greeting everyone. What should we look out for with this gathering? We see the same thing from time to time, Dr. Steffen, whether it is a joyous occasion like a wedding gathering, or perhaps a memorial, or with upcoming holiday gatherings. Give me a little bit of an idea about how do we maintain a closeness, or how do we access a closeness without still being able to keep that distance in there?
Yeah, these are hard situations that I think people are really struggling with. These life events that are occurring where we would normally have these large gathering of individuals, we need to realize that those types of gatherings are going to increase the risk of transmission, and we've seen cases of this occur where there have been significant amount of COVID transmission with gatherings of that type. I think it goes back to those safety precautions that we encourage everyone to take, and those are the physical distancing, mask wearing, and then the last piece is the good hand hygiene. I think that's one that we've always done, but it's never too late to remember to continue to do the hand washing, the hand sanitizing, so that we can ensure that we reduce those transmissions. So, people need to be careful. They need to follow those guidelines and still be able to participate in those occasions.
All right. This question is, any concerns about a shortage of flu vaccine? What have you heard along that line, Dr. Steffen, especially for those who are over 65, because we know that there are, various, vaccines that are out there depending on where we are in life.
Yeah, I haven't heard, John, any concerns about a shortage of flu vaccine. I do encourage people to go out and get the flu vaccine and soon. It's hard to predict when our flu season may begin, but we do know that in order to provide optimal immunity, we want to have that flu vaccine in our system for about 2 weeks before we see flu out in the community. Most flu occurs, between the months of November and February, but it can vary from year to year. So it's difficult. It's hard to try to time the flu vaccine right, but this is smack dab in the perfect time for people to get out there, get their flu vaccine, and get it done.
This question I thought was interesting. Can safe hugs really be safe if both are wearing masks? Can you take an inhale, turn your heads in opposite directions, and hug briefly, and then move away? Or is it best just to keep your distance?
Yeah, John, I think that it's always best to keep the physical distancing, and I'll put this in the context of the more people that you have those close encounters with, the more likely that one of those could have COVID, and the more likely you would be to get COVID. So, I think that physical distancing is always the safest bet. When you're not able to physical distance, ensure that you have a mask on, and so that includes out in public. And so I think people should take those steps, take those precautions, keep themselves safe and keep others safe.
You mentioned this earlier about the importance of walking, and just what a great exercise it is. A concern from an attendee of our webinar here today, Dr. Steffen, is as the weather gets colder and eventual snow, with gyms oftentimes being closed, suggestion you have for exercise this winter. They don't want to risk falling outside in the winter, and as walking has been their main source of exercise. Your thoughts on that?
Yeah, and this is a hard one, John, and this goes back to when we talked about some of these other virtual options that might exist for things that you can do at home. I'll use the example of my mom again, who loves yoga and does a video-based yoga program. And there's a variety of other types of these programs out there that people can engage with. I think it is important and absolutely vital that we stay safe in the wintertime. And let's face it, Minnesota's winters can be pretty brutal. So we're not always able to get outside as much as we like, but really look into those other opportunities that you can do at your home, because I think people will find ones that they really enjoy, and may even continue after those summer months or after those winter months are gone.
All right. This is an interesting idea. People using the concept of, let's say, taking a family vote on how a holiday should be handled, a holiday or an event, as a way to reach a consensus for a framework, and they use, in quotation marks, rules for such events. Probably not a bad idea before you get to Thanksgiving or whatever that event may be, Dr. Steffen.
Yeah, I think it's a great idea. What I wouldn't want to happen, though, John, is that the majority voted not to wear masks or not to physical distance, right? So I think you need to be careful on democratic rule over how these gatherings are run, and that you really maximize the safety. I've seen some interesting concepts out there. I've seen people do meal exchanges and maintain physical distancing. So they drove around and delivered meals to their family members, and then they all got on a Zoom call and shared that meal where they were able to have something that everybody prepared. And so I've seen people take some pretty extreme steps to maintain those family connections and really enjoy the things that they loved to do prior to COVID. And it's really been heartwarming to watch those things occur.
Chatting with Dr. Mark Steffen, the Chief Medical Officer for Blue Cross Blue Shield. I just picture doing that sort of a meal gathering and then having my family hit mute every time I open my mouth. But that's another story. So, hey, here's a couple of questions, because there's been a lot of back and forth about surface versus vapors, air droplets, things of that nature. Should we be wiping off our groceries when we get home from the store before we put them away? Give me your overall thought on that.
Yeah, I think, the problem with COVID is that it's a new virus. And the research hasn't caught up with where we are at. I think it's important that we continue to think about cleaning those surfaces. And obviously foods that we get from the grocery store, we should always be washing and preparing, because, there's not only COVID that can exist on those surfaces, but there's other things that can exist on foods that have surfaces that are exposed. And so, always following those safe food preparation precautions is going to serve us well. I think the jury is out on how frequently COVID is transmitted from a surface to an individual. But I think in this time, we need to be as cautious as possible.
There's a question that came in, and this is one that I wonder about, because like so many, Dr. Steffen, I get a flu shot early, but there have been statements about the duration, the efficacy of a flu vaccine, how long something like that might last, 4 to 6 months or so. So should I hold off as long as possible before getting that flu shot in the season? Give me your thoughts on that one.
Yeah, this is an interesting one, John, and we get the question a lot, and there's not a great answer. I'll tell you what we do know. We do know that you need about 2 weeks to build up your maximal immune response to the flu shot. So you get the flu shot, 2 weeks later, you're going to have a good protection from the flu, at least from the strain of the flu that the flu shot targeted. Exactly right, that over time, our immune response wanes. How quickly that occurs is going to be variable from individual to individual, but over the course of several months, the immunity will wane. The problem with trying to time the flu shot or extend it out, or maybe I'm going to wait until I see the first signs of the flu, sometimes that can be too late. And I think more than ever this year, they're encouraging people, get out, get that flu shot, get it now, and let's be prepared for when the flu season hits.
Do you recommend the shingles vaccine, Dr. Steffen? And is that something, I don't understand all the parameters and guidelines, but I'm guessing that there's probably a good deal of coverage for that.
Yeah, I think, the shingles vaccine is interesting. It's been a fantastic development, John, and another one of the ways that immunizations has really provided benefit for people who have had family or friends who had shingles. It is not a pleasant disease to get, and things that we can do to protect ourselves from that are important. So if you have not had a shingles vaccine, this is a great one to bring up if you're going in for your annual wellness visit, or if you're going in for your physical, to ask your doctor about the shingles vaccine, and make sure that you're able to, and you do get that when it's time.
There is a curious question. This is a personal one because a number of years ago I did have shingles, and I am wondering if that makes me less susceptible to a recurrence, Dr. Steffen, or is that not the same as when you've had some other ailment?
Yeah, shingles is interesting. People can get recurrence of shingles when they have had it already before. It's an interesting disease in that it's a reactivation of the chickenpox virus that most of us got when we were younger kids. Now we need to remember that we have vaccine for that available now, so there's fewer children who are getting the chickenpox that we all grew to love, when we were younger kids. So it is possible to have multiple reactivations of shingles, and I think that's why it's important to talk to your doctor when you're in for that visit to ensure that you're staying up to date on all of those vaccines. And some of these recommendations change over time, so it's important to keep asking that question year over year, because new recommendations do come forward and new vaccines come forward. So making sure that you're up to date on all of those every year when you go in with your doctor, it's a great question to ask.
This is interesting. Another poll that is up and an opportunity. Another poll. Which of the following health goals, if any, do you feel inspired to pursue in the future? We were talking about how some 9 and 10 want to continue to participate. Options there were improve mobility, strength, endurance, lose weight. I got that one. Improve diet and nutrition, better manage a health concern, or practice mindfulness, meditation, or a similar activity. And we'll share some of the results in respondents there. When we get to it, here's a question. This is something that is kind of just everyday, commonplace, ordinary, but give me your take on this, Dr. Steffen. Is it safe to play cards and other games with people that you don't live with if you're wearing a mask? And you can play cards with some distance in there, but if you're wearing the mask, concern about perhaps droplets of whatever COVID vapor might be on the cards. And I'm sure that same goes for, influenza, but give me your thoughts on that one, Doctor.
Yeah, that's an interesting one, John. I had not thought about card playing. It's certainly, those cards are going to change hands frequently. And so it would hold the reason that there's the possibility of transmission there. So, I think that the risk is certainly not zero. You want to make sure that you're maintaining good hand hygiene. And then, I think it harkens back to those important, let's try to maintain physical distance. Let's try to maintain our mask wearing. I think some of the great things are, virtual card playing is a real thing, and people can engage in some of those virtual card games and probably find some of that enjoyment. But yeah, those activities where we might be exchanging items on a frequent basis are certainly going to give the opportunity for us to have more exposure than we might be if we aren't doing that.
Here's a simple question. This was from earlier in our conversation, chatting with Dr. Mark Steffen, the Chief Medical Officer here from Blue Cross. Will you please address the proper wearing of masks and the problem of leaving your nose exposed? Man, I am stunned the number of times I see that, Doctor.
Yeah, I think, John, we have to think about where We talked a little bit earlier about respiratory droplets. Well, those come from our nose too. And the other part is that as we get mucous membranes exposed, and so mucous membranes are the things like the inside of our nose, the inside of our mouth, that's how COVID gets into our bodies. And so as you think about mask wearing, ensuring that that is covering up onto the nose and onto the rim of the nose, and then down underneath the chin, is where you want to see that mask covering occur, so that any type of right in front of the face and those respiratory droplets that might come out of our nose and our mouth are stopped by that mask.
Here's a question too along the mask line. My extended family has various opinions about wearing masks. Plus, some of them are avid huggers. How can you politely handle that? I don't know. I don't have an answer for that. And some of my politeness ends at a certain point. So give me your take on that.
Yeah.
Steffen.
Yeah. I think that we just need to make sure that we're vigilant for ourselves. There's going to be people who are going to have different beliefs about these things. But I think just ensuring that you take that polite way of saying, I really want to make sure that we maintain this physical distance, or I really want to make sure that I have my mask on. I think people are going to understand. I think it's been out in the news and the milieu enough that people will accept reasonable individuals making good choices about their own health.
All right. Here's a question. This is something that I think many of us wonder about. One is the strain of influenza that's out there. When do you find out if there's a good match, or do they test these things ahead of time, Dr. Steffen?
Yeah. So in terms of flu, the smart individuals that are developing these vaccines have to make some guesses around what type of flu they may think will be circulating, and we really can't determine until flu season, until we have flu cases, to understand what strain was actually out there, and did we do a good match. The important thing I would say, John, is don't wait until we see what type of flu strain is out there, because oftentimes that can be too late. The flu vaccine is always going to provide some protection, and I think it's important for the people to get out there and not wait and get that flu vaccine now.
All right. Let me see if we can get through some of these here before we run off the clock. I need the flu shot, the second of the shingles shots, and the pneumonia shot. Is there any reason to not get all three at the same time?
Yeah, I think multiple vaccines have been shown to be safe. There are some that they won't give together, so make sure you check with your doctor. But if we think about and go back to when we give children vaccines, we can typically safely give multiple vaccines in a single visit, and oftentimes we're seeing that they're combining these vaccines into a single shot, particularly in the child arena. So make sure you're asking your physician about the particular vaccines and whether they can be given together, but it's frequent that we give multiple vaccines at a single visit.
Here's one says, this was a question, and I didn't get to the exact question earlier, but about COVID testing and isolation that may follow if you are negative and you continue to maintain some sort of quarantine for several days after that negative test. They're curious about inviting family members into their home for Thanksgiving. We want to be assured that they're COVID free. But is there an assurance for such a thing, Dr. Steffen?
Yeah, this is a hard one, John, because here's what we've seen with COVID. People can be exposed and then not develop any symptoms until 14 days after their exposure. And that gives a pretty long window of time. The other piece of this is that we know that there's people who don't have any symptoms and actually have the virus. And that's probably the hardest part of this, is knowing that there's asymptomatic individuals who can have the virus and can spread the virus. And so, getting true confidence that you won't be exposed is exquisitely difficult. And I think that's why we've taken these great strides and made the recommendations of doing the physical distancing and the mask wearing because of some of the uncertainty as to whether someone may have the virus.
All right, along that same line, how effective are the shields that people might wear, that clear shield, who say they can't breathe with a mask? And are they a better option than wearing the mask below the nose? I think I guess at the answer to that one, but how effective are the shields?
Yeah, I think, shields fall into the category of can be helpful. I think, the CDC recommendations are around those masks, but particularly, John, there are individuals who for one reason or another can't wear masks. And if they can have another option, particularly those that can't wear masks, I think something is better than nothing. Back to the nose exposed comment, it's, we really want to make sure that we're covering up those portions that can spread those respiratory droplets that would transmit COVID. So, we do want to make sure that if you're wearing the mask, get it over your nose.
All right. Are dental visits safe during this time? Gosh, I hope the answer is yes, they can be, since I just had one yesterday.
Yeah. I think the great thing is that we've seen the healthcare community really rally and put systems into place to ensure that people are going to be protected. Now, that being said, John, you will see, and I think people will want to understand, what are the procedures that these clinics and dental offices have in place, because it's going to be different than your visit that you've had before. We've seen healthcare providers that are doing, the waiting room is out in the car, and they'll call you in when it's your turn to see the doctor to minimize exposure. We're certainly going to be seeing them request people to have their masks on. And so I think it's important to understand when you're going to do those appointments, make sure you inquire about what those procedures are. But we have a great healthcare community here, including our dental community, that are doing things to ensure that you're safe when you engage on those appointments.
All right, this kind of goes to what we were talking about earlier when we were talking about the results of the survey that was done, the 500 participants, the survey done by Blue Cross, addressed the special considerations of those living in retirement communities, with special emphasis on the mental well-being problems that the isolation is creating. You addressed that when going through these results, Dr. Steffen, about the 1 in 5 seniors. That's a pretty significant amount, reporting some feelings that go with this.
Yeah, and John, I think we've seen this both in seniors as well as in younger populations. I mean, let's face it, we are meant to be social as human beings, and I think it's been difficult through the pandemic to ensure that we're maintaining those social connections. And I think it's so important, John, that we really emphasize when we say physical distancing, we really mean physical distancing. I want people to ensure that they maintain those social connections, utilize those technologies that we have available to us that really can help us in a really safe manner engage with the people that we love.
A question about a virtual MD visit. We're hearing more and more about that becoming, I mean, it's been something for a while, Dr. Steffen, but is it really worthwhile, is the question from our participant here, since the doctor can't really examine me. Give me your thoughts on that.
Yeah, Johnny, and I know we're getting close to time, so I'll make this my last answer, and I'll try to make it quick. Virtual visits are fantastic, and I think it's going to be one of the great things that we're going to see come out of this COVID pandemic, is that providers have really increased, healthcare providers have increased their capabilities to engage with patients through virtual visits. And I really encourage people to try one. It's not the right thing for everybody. It's certainly not the right thing for every visit, but those capabilities are increasing. And I think people that do engage in virtual visits or telehealth find it a valuable experience. And we're seeing people come back and doing more than one once they've tried it.
All right. Well, I think we're going to have to take this as our opportunity here, Dr. Steffen. Again, Dr. Mark Steffen, the Chief Medical Officer with Blue Cross, talking about these things, and so many of your questions, really thoughtful questions. So I appreciate that. And I apologize for not being able to get to all of the questions. So that's, I don't know, there was many questions from you. And again, as I say, some thoughtful questions. So we look forward, maybe we'll have a chance to do this again down the road, Dr. Steffen, and we'll find out and just see, what the new normal might bring when we go forward with all of this.
Look forward to it, John, and to all those who joined us, thanks. Be safe and stay well.
All right. We'll be in touch, and I know Blue Cross Blue Shield will be in touch as well. And by the way, one quick note before we go: the final poll question was about the percentage of people who have utilized technology during this time, and it was easily 2 to 1, close to 3 to 1, who have taken advantage of that, and that's something that you pointed out earlier, Dr. Steffen. So the opportunities are there, and if you can participate in this gathering, you probably can participate in some of those opportunities as well.
Couldn't agree more, John.
Have a great day. Thank you for sharing.
Thanks all. Bye-bye.